doctor as he's already not doing enough singing Rise Up. Remember, we are on Facebook and YouTube. Check that out, everybody. We'll see you tomorrow, same time, same place. Hit it, Doc.
And I'll rise up like the day I'll rise up. Rise unafraid, I'll rise up. And I'll do it 1,000 times again.
Across the country, individuals and small businesses have taken up the challenge to help with our face mask shortage, only to find a shortage of highly effective face mask material. At Filty, we're on a mission to help. Whether you're making masks for our first responders or healthcare workers, our goal is to provide you the best face mask material possible. Our nanofiber technology is up to 10 times more effective on small particles than fabric masks. Join in the fight against COVID-19. Visit Filty.com for details.
What's up, man?
Man, I hurt my back at work yesterday, so I called Morris Bart.
Really? Morris Bart? I didn't know he had a work accident.
I'm attorney Morris Bart. If you're injured on the job, we'll get to work right away on your claim to get you the maximum benefits you deserve.
When you have a hole in your neck, don't face the shower head. Be very careful shaving. Clean out your speech valve twice a day.
You can quit. Call 1-800-QUIT now.
Have you wanted to speak a new language, but thought it would be too difficult? Then try Babbel. Babbel starts by teaching you words and phrases that gradually get more complex. Soon, you're practicing short conversations. So in 15 minutes a day, you'll be speaking a new language in a few weeks. Babbel works because it's built around real life. It teaches you everyday practical conversations that you will actually use. Babbel, language for life. Try it free at Babbel.com.
I just love hitting the open road and telling people that Liberty Mutual customizes your insurance, so you only pay for what you need.
Only pay for what you need.
Liberty, 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 liberty.
New Kinder Bueno. Wow. It's crispy. It's creamy. It's not your average chocolate bar. Smooth milk chocolate, crispy wafer, and creamy hazelnut filling. It's new Kinder Bueno.
Today, all new from our studio before the quarantine. A 10-year-old so out of control.
Zach has bit Denise.
Zach has gotten so violent 3 different times I have had to call the police.
Do you believe he would have stabbed his brother?
Oh, absolutely.
His grandparents were called in to help.
Everybody is living together.
Denise and I have to take full-time care of Zach. It's what we do. It's fine.
This is not just him being out of control. He is very much in control. He's smart enough to recognize how to divide and conquer. And he's playing the 4 of you like a fiddle. Today's going to be a changing day in your life. You've never had anybody working harder to bring you to the threshold of change than right now. I want you to imagine living with a little boy who you constantly fear. A little boy that's growing up. He screams in your face, punches, and destroys things in your home. Take a look.
Stop! Stop! Oh, I hope she dies tonight. I want to die.
Don't rip up that stuff that belongs to Grandma.
I don't care. She can go get new.
You know, I've always said, if you're going to have a battle, you need to do it while they're really small, because they get bigger and stronger, and it just becomes a physical war. Now, that was 10-year-old Zach. Now, his mom, Denise, says she had to quit her job just to watch her son full-time 24/7. Yet, the temper tantrums just continue. Now, currently, Denise and her husband, Jared, are living with Jared's parents to get even more boots on the ground. So why can't 4 grown adults control one 10-year-old child's behavior? Well, Denise and Jared claim it's way more complicated than people realize.
Dad, I want to kill you. Sleep.
My 10-year-old son, Zach's anger is severely out of control.
Every time I come home from work, you don't know what Zach you're going to get.
If he doesn't get what he wants, he will.
Good afternoon, I'm Karen Swenson. Thank you for joining us. We're going to listen in now on a live update on the coronavirus with Governor John Bel Edwards and possibly plans to reopen the state economy. Also, we should mention President Trump is expected to hold a press conference at about the same time. We'll be carrying that on our sister station, WUPL.
To show our appreciation or to repay them or to thank them. And so I'm just going to ask everyone to lift the families of those 3 officers up in prayer. And the rest of the briefing isn't the message that I had hoped to deliver either. Yesterday afternoon, we spent a number of hours looking at all of the data, and I spoke with 4 different epidemiologists from across the state, met with medical experts from the Department of Health in order to determine where we are in relation to the spread of COVID-19. Flattening the curve. We looked at the data, as I said. We used the reopening plan from the White House as our guidepost and followed the science. Obviously, my hope, as I had expressed to you all before, was that we would be taking bigger steps toward reopening and moving toward some semblance of normalcy than what I'm going to be able to announce today. But the fact is that we just don't meet the criteria. And that is why today I'm announcing that we'll be extending the stay-at-home order, which expires on Thursday, April the 30th until May the 15th. Now, for sure, there are some promising signs about flattening the curve at the state level. And in fact, we're going to report numbers today, if you haven't seen them, because I think they've been up already. 295 new cases, bringing us to a total of 27,068. Sadly, we're reporting 27 new deaths for a total of 1,697. We do have to keep in mind that these are numbers that would have been developed yesterday, and Sunday's numbers and Monday's numbers have historically been low. And in fact, I will tell you that's the lowest number of cases and deaths since March the 29th. But if you go back to March the 29th, which was also a Sunday, then by Tuesday, the numbers had increased by 5 times. And so I just want to put some context into those numbers. Obviously, we like to see low numbers anytime we can see them, but we want to make sure that there's an expectation that things might increase again. Now, I certainly don't expect a 5 times increase Tuesday, and I hope we don't see that. Louisiana has successfully stopped short of overwhelming the healthcare system, and that's because of the people who took seriously the stay-home order. They took seriously social distancing and hygiene, and I really appreciate it. There were a lot of people who did get sick, but they were able to get the care that they needed, and many other people didn't get sick. But what we know is the actions that have been taken by Louisianans all across the state have literally saved lives, many, many lives. But when we dig into the data at the regional level, the picture is less rosy. There are criteria on the White House plan that we need to meet before moving to phase 1, and you measure them 3 different things. The people seeking medical care for symptoms of COVID-19, new cases, and hospitalizations. And these should all be going down for at least 14 days, while Louisiana is using that time to ramp up testing and contact tracing capacity across the state. Unfortunately, it's not the case. Louisiana does not have consistent decreases in both new cases and new hospitalizations. And it's not just 1 or 2 regions. And in fact, 1/3 of our 9 regions, Louisiana is still seeing increases in case counts. And one of those regions has actually plateaued rather than going down. With respect to hospitalizations, 2 regions are experiencing increases and 2 have plateaued. So they aren't going down either. So as I said before, the state doesn't meet the criteria for moving to phase 1 under the guidelines. In addition, Louisiana's confirmed more than 27,000 cases of COVID-19. And we estimate, under the criteria that we've been told to use, about 17,000 of those have recovered. Well, that means we've got at least 10,000 COVID-19 positive people in Louisiana right now. And all 10,000 of those became ill during the stay-home order. Just to kind of put this into perspective. And so they became ill when residents were under the restrictions to not leave their homes except for essential activities. Every single doctor and scientist who is advising me agreed that we need to be extremely cautious moving forward, and they support the decision that I am announcing today. And again, the decision to extend the date of the stay-home order is based on the data that we have, based upon science, and the White House guidance for a phased reopening for states. Earlier today, I was able to speak with the Vice President. I informed him of my decision, and he told me that he supported the decision, and quite frankly, it's not terribly surprising when you know that we're number 6 in the country per capita for cases, and the rate of case growth that we had experienced in the hot spots that we had, especially in Orleans and Jefferson Parish. And I know that some may be looking to other states in our region and looking to see what they're doing and wondering why we can't match our schedule with theirs. But the reality is that the disease has spread through our state at a rate and in numbers that far exceeds those of our neighbors. Again, we're still 6th in cases per capita for the entire country. As best I can tell, none of the top 10 states are moving towards phase 1 opening on May the 1st. And we have more in common, obviously, with these cases, with these states who have high per capita case counts. And I believe that we have to be smart in reopening our economy, because if we move too quickly, that won't be good for public health or for the economy, and we would end up having to slam on the brakes and then actually go back to more restrictions. I don't think that that's the way to go. I'd also ask people to remember that Louisiana had its first confirmed case on March the 9th. In 48 days, we jumped to 27,068 cases. And for a while there, Louisiana had the highest growth rate in the world and the second most cases per capita in the country. Under the extended order for 2 more weeks, businesses that previously were directed to be closed will remain closed. These include the salons and barbershops, bars, casinos, among others. Businesses that are deemed essential will still be open, and we continue to follow the CISA guidelines as we have throughout. That's the Cybersecurity and Infrastructure Security Agency under the Department of Homeland Security. And by the way, they're currently on their 3rd version of that essential infrastructure. But we will follow all of those as being essential. And then non-essential retail business have always been able to be open. We never did close them down in the order. But we did put, and they still have, a restriction of 10 people that can be inside those stores at a time. I encourage business owners to read the order closely in order to understand exactly which category they fall in and to proceed accordingly. And I would point out that some states closed non-essential retail completely. And as they're reopening now, they're reopening this non-essential retail in a way that's more restrictive than they've been open the entire time here in Louisiana. Places of worship will also remain open with a 10-person limit, so that has not changed. There are 3 noteworthy changes, and these will all be in place on Friday when we issue the next order. First of all, malls will remain closed to the public, but stores may be open for curbside delivery. Second, restaurants are going to be allowed to open their outside areas for patrons to eat meals without table service. So you're not going to be able to sit down and have somebody bring you the meal, and they're not going to wait on you and so forth. But if there is a table outside at a restaurant, when you pick that meal up, then you'll be able to eat it at that table. Obviously, social distancing from others so that you're not closer than 6 feet. Thirdly, employees of businesses that are interacting with the public must wear masks or face coverings. That will be effective this Friday in the order that we will be issuing. And speaking of masks, I'm going to make a strong appeal to the people of Louisiana to wear masks or face coverings when in public. This is now a recommendation of the CDC. It's a recommendation of the Department of Health. We know that this is very important in order to reduce the spread of this particular virus. And we're asking businesses, therefore, to encourage their customers to wear masks or other facial coverings whenever they're in those businesses. If we meet the White House guidelines on symptoms, cases, and hospital capacity, and testing and contact tracing ramp up as we expect that we will, hope that we will move to phase 1 on May the 15th. And if so, we will make that announcement 2 weeks from today on May the 11th. Just to give a better idea of what that would look like, phase 1 will lift the stay-at-home order and ease restrictions on some public spaces like houses of worship and restaurants, and allow some places that have been closed to reopen, such as barbershops and salons. But with the restriction of 25% of their licensed occupancy, the occupancy that they're allowed to have in those businesses, along with strict requirements for social distancing and mask and facial covering usage. Businesses and faith leaders should use this time between now and when we actually do get into phase 1 to confirm their occupancy of their buildings with local government or the state fire marshal office, and to make plans for how to open up consistent with these guidelines so that they can safely bring their worshipers or customers into their businesses, engage in the social distancing that's going to be required, and they can also use this time to make sure that their employees have the requisite masks as well. Look, the people of Louisiana are strong, and it is through their actions, it is through their patience, their determination that we've been able to make substantial progress. We are moving in the right direction. And by taking the stay-at-home order seriously, we are well on our way to entering the next phase of reopening. We're much closer to phase 1 today than we would have been without it, obviously. And I'm hopeful that everyone will view the extended 2 weeks as time to adjust to this new normal, as time to make or buy a face covering if you haven't already done so. Remember, when you wear a mask, it protects those around you. And when others wear a mask, it protects you. This is the neighborly thing to do, and it will help us all to stay healthier. Today is a beautiful day. And as a reminder, get out there and enjoy the beautiful weather while maintaining social distancing of 6 feet between you and people who are not living with you in your household. Get out there and exercise. It's good for your mental health as well. And I think it's necessary to get out and enjoy the fresh air whenever possible. And again, we're going to get through this together. But we're only going to be successful by following the data and the science. We intend to do that, but we also intend to make sure that we're progressing so that we will meet these measures that we're looking at over a 14-day window. I forgot to go to the slide here. You can, actually it's been up there, but you can see those areas where cases are increasing or have plateaued and are not decreasing, and where hospitalizations are increasing or have plateaued and not decreasing. So obviously there's a lot of good work going on here. It's just not enough that we feel comfortable, because what we can't do right now is create new hotspots when we don't have the ability to adequately test those that we already have until we can ramp up that capacity. And so that's why these criteria were selected in the first place. And I'm going to ask Dr. Bu to come up and provide a little more context for these numbers. And then after that, we will take your questions He is the expert, and so if you have really detailed questions about the information you're seeing on the graphs, I would ask you to go ahead and address those to Dr. Bu while he's still at the podium. Thank you. Dr. Bu?
So as the governor noted, we've been working as a team both internally within the Department of Health and the state, but also with external experts, epidemiologists, scientists, doctors, really since the beginning, but most recently focused on how to interpret the plan and how to build a plan for reopening Louisiana that focused on a lot of the data that the White House has pointed to. We agreed with the White House recommendations that really it makes sense to look at this continuum of factors that represent a potential pathway that people take when they're COVID infected. Looking first at COVID-like illness. These are people presenting to emergency departments and other healthcare settings with symptoms consistent with being having COVID-19. We've talked a lot about these in the past: cough, shortness of breath, fever, sore throat, and actually the CDC has added to that list shaking, chills, losing your sense of taste or smell. We measure that already. We've been measuring that for some time. Next, somebody with those symptoms should go on to get tested. And what we would then see is that if somebody actually has COVID-19, they should show up as one of our cases. So the next thing that we look at is what's going on over time with our cases. And then unfortunately, we know that anywhere between 12 and 14% of individuals on average who are diagnosed with COVID-19 will unfortunately become ill enough that they need to be hospitalized. And of course, when we're thinking about the plans to reopen the state, the most critical infrastructure that we need to be thinking about and preserving is our healthcare system's ability to respond to people who are ill, to reduce the likelihood that there's not adequate resources to treat them, and that we avoid avoidable deaths. And so hospitalizations is the third measure that we spent a great deal of time looking at. My team and external experts reviewed all of this data, and as the governor noted, our assessment was that we were not going in the right direction in a number of regions, and our strong recommendation to the governor was that it was too soon to remove the stay-at-home restrictions at this time. I will also say, though, our feeling was that the measures that we are taking currently are working. As the governor noted, we have 27,000 cases, but if you go by our estimates, we think that we have over half of people who've been able to be recovered by this point. But that still leaves 10,000 individuals, around 10,000 individuals that are still out there and likely infected. And when we think about where we started at the beginning of this epidemic with a few cases leading to the widespread outbreak that we have now, and then you think about removing restrictions when you have 10,000 actively infected people, it was the unanimous feeling of myself and all of the experts that that was a dangerous situation as we start to relieve those restrictions. We are a hybrid state, and frankly, that's reflected even in the guidance that we've seen from the White House and in our discussions with the CDC. They do not treat all states equally. They acknowledge the fact that the risks are much higher when you have a high burden of disease in your state, and that certainly is the position we're in, as the governor noted, as one of the as number 6 in per capita burden. So we do feel that there is some improvement that's going on, in fact, significant improvement going on, but what this graphic shows you is that's unfortunately not evenly distributed. In fact, if you look at the state from a standpoint of COVID-like illness, cases, and hospitalizations, we see that there are decreases across all three of those measures, but those are really driven largely by Region 1, and that's the greater New Orleans area, which had the highest number of cases, but frankly where we've seen really strict adherence to the stay-at-home order, and we've seen the most precipitous fall, the biggest fall in all of these measures. When we look at individual regions, and maybe we'll go to the next slide, you can see that there are several regions where we frankly have increasing numbers of cases. So this is looking at our epidemic curves, which again were constructed using the CDC guidance. And what you see is in regions 2, so the greater capital area, region 4, Acadiana, and region 8, the Delta region around Monroe, we have an increase in cases. This is over the last 2-week period. And then frankly, in the Florida parishes and the area of the North Shore and Region 9, we are plateauing. We're not seeing the decreases that we're seeing that are in the other regions of the state. And unfortunately, that's also translating to what we're seeing in hospitalizations. On the next slide, this is Region 2 showing you per capita hospitalizations, and that's not the way that we want this curve going. The yellow or orangish, if you will, color there really shows you that last 14 days, but you can see even long before the last 14 days, there was a steady rise in per capita cases in Region 2. And if we look at Region 8, we see a similar thing. Again, we're seeing this sort of undulating pattern, but the general trend is increasing. And you know, we're not basing the criteria off of looking at things like cell phone data, but we know that this correlates with what we've been talking about before with websites like Unicast, with Google's assessment of social distancing. Regions where we're not seeing great social distancing, not surprisingly, we're seeing cases. Not surprisingly, but sadly, we're seeing hospitalizations. And so our emphasis and our point to the governor was that we needed more time to see higher decrease in cases over time. We also needed time to work with these regions specifically to make sure that we're doing what we can to stop the spread of COVID-19. Reduce the burden in the state so that it is safe to relax restrictions and go back to opening up businesses in a safe and systematic fashion. I'll end just by noting, just as the governor did, we do want to emphasize, though, that there are settings where it's safe to be, and that's outdoors. And I think especially as the weather's improving, we do want to encourage people to understand that there's a difference between being around people in a building where the air is not circulating as well as it should, and being outdoors. In both of those circumstances, we recommend social distancing, staying at least 6 feet away from individuals, and we also recommend wearing a mask when you're around individuals that are not in your immediate household. So again, whether you're indoors or outdoors, if you're around folks who are not in your immediate household, recommend wearing a mask and distancing at least 6 feet. But encourage you to go out and do that and talk to your neighbors and enjoy the weather and enjoy some outdoor dining at restaurants. That is a much safer environment to be in as we move forward than being indoors. When we get the burden down, when we see that cases are going down and hospitalizations are improving, we'll then be able to move that same activity indoors. And now we'll be used to wearing masks, and we'll be ready to do social distancing at counters and other sort of limited retail engagements, but wearing a mask as we're speaking with each other and with each other. So we do think that, again, overall the trajectory of the state is really positive, but we think that it's going to take a little bit more time for us to be in this position. And I'm happy to take questions.
Can you tell us who are these experts you're talking about who are consulting with the governor on making these decisions and supported this idea? And also, can you talk more about why those specific areas, even though we're under a stay-at-home order, are experiencing increases? Is it just a matter that the people aren't adhering to the stay-at-home order well enough?
So for the first one, I can get you those names. We had individuals from Tulane University, LSU, that joined us in our meeting with the governor, and epidemiologists, people who have a background in behavior change, communications, and all those sorts of different areas that we needed to be having looking at the data, as well as our own experts, our state epidemiologists, and the secretary and myself and others looking at the data. To your second question, I don't have an answer that's data driven. I have conjecture. I can tell you, as we've been saying for weeks, we've been seeing in the capital area more people on the road. I think we've all had experiences when we go out and about that we're not seeing people wearing masks as all of you are. And you know, we know that on the weekends, because the weather's been nicer some of the weekends, unfortunately not very nice in every region of the state, that we've had people who are doing things like neighborhood get-togethers. And so those things, understandable. There's an understandable urge to be together, but they are quite frankly problematic because they create the right setting for us to be spreading virus amongst our neighbors. And so we can go to those things. We can be outdoors together, but we need to be 6 feet far apart from each other and wearing masks. Next question.
Where do we think we'll be in 2 weeks in terms of testing and contact tracing so that businesses can reopen more safely?
So that's a great question, because that's the other thing that a little bit of time also gives us, time to see these improvements, but it also will mean that we'll be that further ahead in having the infrastructure that we need, which is another set of criteria that the White House put in their document as well. So we are currently working on surging our testing. Our goal to get to about 140 to 150,000 tests at least, and up to 200,000 tests in the month of May. We're starting at about halfway there. We think by halfway through the month we'll be another halfway towards that goal. With contact tracing, that's the taking each case that you find, identifying that individual, interviewing them, identifying their contacts, and reaching out to them. We think that we'll be, again, probably 25%, 30% of the way down the road to where we'd want to be by the end of May in that period of time. In the meantime, we're working hard to get even more of those contracts and individuals on board, because we'd like to be even further along by that point.
Can you give us a number of how many you have to hire and who's paying for it?
So we've estimated, based off Massachusetts numbers, that we think we need 700 contact tracers. I'll say that's Massachusetts population density. We also think it may be less. One of the points that our epidemiologist made is that the number of contacts that they're reaching now is much less than the average of 10. People are staying at home, so there's fewer people that we're having to track. So it may be that we need fewer people than we're estimating, but we'd rather overestimate and have too much supply than find ourselves unable to do the work that we need to do.
Yeah, let me add something. So these are emergency protective measures when you do the contact tracing. So this is an allowable expense under the Stafford Act. So we would be submitting that through FEMA for reimbursement at either the 75% level or the 90% level, and that depends on the total amount of expenditures that are approved by FEMA from the state. We feel pretty confident that we're going to end up getting to the 90-10 match. Secondly, today in the White House Coronavirus Task Force conference, telephone conference that we had, video conference, with the President and the Vice President, they presented on testing. Every state last week, and I think it was last Wednesday, submitted their testing plans to the federal government, to the CDC. And they took those plans and they put them in a matrix. They announced today that they're going to be able to meet every single state's testing plans with resources relative to swabs, the viral transport medium, and other and reagents. So our plan is for 200,000 tests in the month of May. If we do that, we will test 4.3% of our state's population. That's almost twice as much as Dr. Birx recommended as the minimum amount that you should try to do. So we feel very confident, especially since that call happened today, that in the month of May we are going to see a continued surge in our testing capacity. And because the only way that you can observe what's going on in communities is through testing. And when you see cases spike, then you have to take corrective action. And hopefully when you're testing enough and doing the contact tracing, you can keep that lid on and allow for the phased reopening of the economy. Secondly, and this is the first time that I recall hearing Dr. Birx mention this, is we are going to get to the point where we need to start testing people who are asymptomatic or mildly symptomatic. Because we know the numbers we talked about a while ago, these are all confirmed COVID cases because there's been a test. There's a significant percentage of the population who remain asymptomatic even though they have COVID-19 and they are shedding virus. And so we have to start testing in that population too, and those who are so mildly symptomatic that they are not reporting for testing. And that's why we have to ramp up as much as what they're talking about. And I don't know, you might have a different perspective on this than I do. That's the first time I can remember Dr. Birx talking about moving testing to those who are asymptomatic. And so that represents a pretty big change in what we've been doing. Yes, sir, Jeff?
Is there actually a scientific study that shows that the stay-at-home orders actually reduce the number of cases? Because there's some people that look at states that don't have a stay-at-home order and say, boy, they got a lot fewer cases than Louisiana. Why is that?
Yeah, well, first of all, I would tell you that there's certainly modeling that would predict what would happen in a state without a stay-at-home order. And then we know what happened in our state once we implemented one. And we know based on early transmission numbers what we believe the R naught to be, the rate of transmission, which was in that 2.4 range. And then when we put the very first social distancing in and minimized put some restrictions on crowd size, we thought that it would get down from 2.4 to about 1.7, as I recall. And then the stay-at-home is 1.3. And over time, we actually tracked it in that way. so that the stay-at-home order, at least by cases, actually is tracking a little below the 1.3. And as I mentioned to you all last week, by deaths, it's slightly above a 1.3. And so you can then compare what the modeling suggested you would get in cases and deaths without the stay-at-home order with what you actually got. And that is how I'm able to say that there are hundreds, if not thousands, of people alive in Louisiana today who would not be but for the stay-at-home order. I mean, that's the way the math works. And the reason is because these are exponential growth patterns. That's the way the R0 works. And so yeah, when you say study, I know that you have modeling and then you have the data that you actually experience. And when you compare the two, that's the results that you get. Yes, sir.
Governor, would you explain again why you chose not to reopen in a parish by parish?
Yeah.
The White House did issue some guidance that said that would be appropriate.
No.
Could be appropriate.
It said it could be under certain circumstances, but it would obviously be left to the governor's discretion. And the reason I chose not to do it is because we have enough places around the state. It's not like you have just the southeast corner of the state. You have enough population centers around the state where cases are increasing and hospitalizations are increasing that I don't feel it's appropriate to do this by region or by parish. And what we don't want to do is allow a hotspot to be created where one doesn't exist today when we don't yet have the ramped up testing capacity to adequately test the hotspots that we are dealing with. And so for all of those reasons, I decided not to go on a parish by parish basis. And the other thing that I mentioned, I think I mentioned this earlier when I was speaking, is when we look at the restrictions that we currently have in place, there are places that actually have a lot less COVID-19, a lot less cases, especially on a per capita basis, who are reopening their economy to some restrictions that are actually still more restrictive than what we've been experiencing. So for all of those reasons, and until we can get our testing capacity ramped up in the month of May, as I told you, I believe we're going to do, and as we enhance our capacity to do contact tracing, I thought it was best to do this for 2 more weeks. And there was not a single person who was a medical doctor or scientist advising me on this who held a contrary view. And this is a public health emergency. And so knowing where we are as a state in terms of our per capita cases, the disease burden, and every day I spend with Dr. BU, I learn a lot of new terminology, but the disease burden in Louisiana is just substantially higher than it is in all but 5 other states. And so this is just unfortunately where we are. I have no doubt it's the best decision for our state, and that if we will continue doing what we need to do, then we're going to be able to meet those gated criteria, those 3 criteria that we've been talking about, and proceed to phase 1. Yes, ma'am.
Governor, do you think that there are some businesses and retailers that don't understand they are currently allowed to be open under the existing stay-at-home order? And then also, how do you square the ability for those stores to be open while you're still telling people they should be staying home and not going to the store, basically?
Well, first of all, we've never told people never to go out. There's always going to be essential activities, just like there are essential infrastructure, and that you do need to go out as necessary to get food, to get prescription drugs, to go to the bank, go to the drugstore, those sorts of things, and all of those things were deemed essential. Now, it's hard for me to answer your question because what I know is there are some national chains, for example, that have made decisions in their corporate headquarters separate and apart from what the governors of the various states have been deciding. And so sometimes you have these chains that will just close all of their stores regardless of what state they're in, and it doesn't look at how prevalent the disease is or what the restrictions are that the governor has mentioned, or has in place, I should say. And with respect to any particular business, I can't answer whether if they closed and I didn't order them closed, it was because they made a decision to do that, whether they didn't understand what the order was, or whether there was some national chain involved. I really just can't answer the question, but I am encouraging every business owner to make sure that they're looking at this order and seeing which category that they are in. Yes, sir.
Governor, as far as compliance, we've asked you about it in the past relative to the current stay-at-home order. As far as the public-facing employers needing to wear masks, and then maybe the patio seating to eat, how is that going to be self-policed by the businesses? How is that going to kind of be watched?
Well, the need to have your employees wearing a mask if they're going to be interacting with the public, that's part of the order. That's required. With respect to eating on premises, again, so we're not really changing the way the restaurant does business from today. You're going to drive through or pick up, and they can do delivery, but obviously we're not talking about delivery. But for those people picking up, if they want to, and there is a table outside, and they can sit at that table while social distancing, they can sit and eat. But the restaurant is not going to be able to wait on them and go back and forth into the restaurant, serve them their food, bring them drinks, because that's the contact that we're trying to avoid right now. I think it's a meaningful, but it is admittedly a measured lessening of the restrictions that they have. But it goes back to what Dr. BU was saying a while ago. We know that outdoors is just much safer than indoors when it comes to the spread of this virus. And so this is something that we felt it was proper to do. Yes, sir.
Governor, I know this decision has probably been really hard for you. What do you kind of say to those people who want to reopen the economy? I know you've had some people outside your house for the past few days. What do you say to those people, and why this has been such a hard decision for you as well? Yeah, well, first of all, I don't believe there's anybody out there who wants to reopen the economy more than I do. But at the same time, I'm the only person charged with the Constitution and has the responsibility under the law to be the decision maker and weigh public health on the one hand with the economy on the other and try to strike the right balance. And when you do those things, when you have to make those decisions, you look at the White House guidance. You look at the numbers, where we are over the last 14 days, and you talk to experts. And you try to strike the right balance. That's what I have done here. And what I would say to people who are frustrated is, look, I share that frustration. There's nothing about this that's easy. I would much rather have come out here today and say, hey, we looked at all the criteria, we met them all. We're going to go to phase one. I think people would probably be disappointed when they saw just how measured phase one is relative to where we are right now. But I would love to be out here saying that, but that's just not where we are. And the one thing that I refuse to do is to fudge that. I'm not going to pretend that we're better off than we are, but I am very gratified that we're in a much better place than we thought we might be if you go back 4, 5, 6 weeks and you look at the case growth and so forth. And again, for those frustrated people, I would just ask them to compare and contrast Louisiana with other states based on per capita case counts. The nearest neighbor we have to us is Mississippi right now. We have 4 times the per capita cases that Mississippi does. So we're just not in the place that they are. And that's unfortunate, but it is the reality. And the worst thing I can do is ignore the reality, pretend that we're in a better place than we are, only to have more contact and more cases to spike, put more demand on our hospitals before we've had a chance to get into the month of May, where we believe, based on what we were told today, we're going to greatly increase the testing that we're doing. And that's all important in this too. And it is part of the White House guidance, by the way. It's not just these 3 criteria, but you're supposed to be ramping up your capacity to test so that you can monitor what's going on and clamp down when it becomes necessary, and contact tracing. Andre?
Do you anticipate, though, that people being people will still spill over in greater numbers with protests in different places where you'd have to bring resources to?
I don't know. I hope not. I hope that they can see that we are making progress. We're not quite there yet. and that they would, rather than doing that they would be focused on leaning forward and figuring out how they get prepared for phase one, and that they don't do things between now and then that make it less likely that we will actually meet the criteria, so that they don't go out and do things that would actually cause the cases to spike because they lose their discipline and they stop following the stay-at-home order, they stop social distancing, they stop doing the hygiene that we've been asking of them. And that's really what I think the overwhelming majority of Louisianans are going to do. But for those people who protest, look, I get it. This is the United States of America. Not everybody is going to agree. And look, I understand that. It would please me to some degree if they would protest in a way that maintains some social distancing and so forth. But you know, ultimately we're going to get through this, Andre. I am confident that. Yes, ma'am. Go ahead.
Have you talked to the legislative leadership today about what their plans are, and is it true that they're still thinking about going forward with May 1st?
I'm not sure. I did speak with the Speaker and the President earlier this afternoon to tell them that we had that I had made a decision based on the information that we have over the last 14 days that was presented to me last night, and then waited to make it official until after the phone call with the White House today to make sure that their guidance hadn't changed and so forth. And then once that call was over, I then engaged with Speaker Sexsnyder and President Cortez to make sure they knew what the decision was. We did not talk about what the session might look like and when they might return. And I would tell you that I believe that is their decision to make. I happen to believe the legislature is like essential infrastructure. We didn't close essential infrastructure, and the legislature shouldn't be closed because we have the month of May to get a budget in place. Otherwise, if you get to July 1st and you don't have one, you don't continue to operate. So it's essential infrastructure. I believe that they're going to need to meet. They have to decide whether they want to start meeting on May the 1st or May the 15th or some other time. But I would hope they leave themselves enough time to get the essential work done. And so there's essential infrastructure. There's essential work that has to take place at the Capitol with the legislature. It is, however, incumbent upon all of us to make sure that we understand it is not business as usual. Because there's still protective measures that we have to put in place so that you don't have more people in the Capitol than necessary at one time, and certainly not in the committee rooms and all of those sorts of things. And I know that those are things that the Speaker and the President are thinking about. We had a long meeting here, I want to say it was last Wednesday or Thursday, and they were telling me they were thinking about those things. Yes, sir.
Sorry, Governor. As you briefed the legislative leaders or your congressional delegation or your mayors today before this, what kind of pushback have you gotten, if any?
You know, I haven't gotten pushback because I just haven't. There are some who've expressed disappointment, but you know, it's kind of like the disappointment that I expressed too. I really wanted us to be further along than we actually are. But not anything that I would say was pushback. Yes, ma'am.
Governor, you talked about who was involved in the decision-making on this piece of things. Did you reach out to business leaders or anyone on the economic side of things to notify them that this was coming, or to get their input about ways they perhaps thought they could be able to comply with loosened restrictions and still protect people?
Well, the business, first of all, we've created the task force, as you know, and we have 15 business sectors that are represented, and they're doing those things right now. But the business leaders couldn't tell me whether we met the criteria that were set forth by the White House as it related to those three things: the COVID-like illnesses that were showing up in our emergency departments, the number of cases, the COVID burden across the state of Louisiana, and hospitalization capacity. So we've certainly been talking to businesses, but when it came to seeing whether we met those criteria, and then looking at the testing we have in place and our plan to ramp it up and contact tracing, that wasn't something that the business community could inform my decision on. And so we made the decision last night based on the presentation, because you had to have the most recent 14 days you could have, because that's the period of time that we were looking at. And then it wasn't final until I had my call with the White House today, because I wanted to make sure, since we were relying so heavily on their framework, their guidance, that they didn't change that in any way. And of course, they did not. Leo, very patient back there.
East Baton Rouge Parish has given out a survey to parents and said, go ahead and gear up in case we wind up having to be in home for the fall. Have you heard anything else from the Department of Education on how they plan on trying to make up for this year, or finish out this year and then start the next one on time?
Yeah, well, first of all, they're going to finish up this year through distance learning. Some of it high tech, some of it low tech, and we've talked about that. I haven't heard about any statewide plan that would start looking at next fall yet. I suspect there are multiple districts around the state that are trying to get ahead of things and try to figure out what they would do under certain circumstances. But actually, I hadn't heard that about East Baton Rouge Parish until you just mentioned it. And I don't really read anything into that other than the leadership is trying to get as far out in front as possible. But I don't think we're going to have the facts that are going to guide that decision for some time to come. And again, it's my hope that the conditions improve on the ground tremendously between now and this fall, and certainly soon enough that is not going to be required. But I haven't had any conversation with either the superintendent here in East Baton Rouge or Beth Ciano, the interim superintendent for the state, who talked about anything like that. Yes, sir.
Governor, going back to kind of what I asked about the masks earlier and other resources. So for those businesses that will be open, the employees having to wear masks, and then say for some of the businesses that may open May 16th, if we get to phase one, is it kind of by themselves got to figure out how to get their gloves or their disinfectant spray or their cover-ups, whatever? Is it kind of on them to get their materials and resources that they need to be
Well, it is, and look, masks can be made, they can be bought, and they should not be, in fact, N95 masks that we're trying to make sure are reserved right now for healthcare providers. But they should be used in this time to really look at what the world's going to look like when we get to phase one as it relates to their particular businesses, and they get that straight. So, for example, they know what 25% of their occupancy is, and that they can accommodate people up at that level, and make sure that they do the social distancing that they're required to do, for example, that they are able to clean more frequently, that they do have the mask for facial coverings for employees, for example. So that's all the things that people should be doing right now, and it's really important. And I'm gonna again stress this, because I'm asking the public, when you're out in public and you're interacting with people who are not from your household, you really need to have a mask on. You're protecting them, they're protecting you, and it's critically important that people do that. It is both a CDC recommendation and a recommendation of the Louisiana Department of Health, and it's being a good neighbor. Leo? Yeah.
I have a question for Dr. Villiers.
Okay.
When you had the map up, it showed where Ouachita Parish and Northeast Louisiana were in red. Last week you had told us that LSU Medical Center in Shreveport really ramped up on testing faster than just about anybody in Orleans and Jefferson. Now I see that the Shreveport area is decreasing, and they have only about a 6% rate last week, of testing that was positive. Why would Ouachita Parish in that area be into the red now, or is this just the result of a lag in the testing?
So there's a couple of things that happened right at the end of last week. Remember, we went through, looked at all of our data, deduplicated it, and had now tests performed or being reported on the website. The more important change that we made, though, is we now are reporting tests as performed on the resident, where the resident is from, the parish of residence for that individual. So what you saw was, I think you'd asked me previously about this very large number that we had really in Caddo, and what now you see is that was actually them testing for a broad swath of northern Louisiana. So you saw these testing numbers go out. So that's what reflects.
One more question. Yes, ma'am.
All right. Well, it's a two-part question about our incarcerated population. A couple weeks ago, Jimmy LeBlanc came up here and said that he was considering medical furloughs for a very specific eligible population that was within 6 months of parole.
Yeah, and not technically medical furloughs, just furloughs, but they had to be individuals who were serving a sentence for a nonviolent, non-sex offense within 6 months of the end of their sentence, and then they had to have a home to go to, and there were some other criteria. Yes.
Yeah. How have those been granted at all?
They have, and I did not bring those numbers in here. And I know that those panels continue to meet. If you remember, there were 6 panel members. 5 of 6 had to vote in favor of. The last I remember getting a percentage from him, it was somewhere between 25 and 30% or so of those people who were being considered were actually being approved by the panel. And those panels continue to meet, and I don't know where we are today in terms of the total numbers, but I can get that to you.
All right. And part 2 was a number of activists and advocates have reached out to me and said that there are some clemency applications that have been on your desk since before the pandemic started, and they have a sense of urgency to get these people out. Are you going to be considering signing those anytime soon?
Well, look, I consider clemencies whenever I get to them. I have signed some clemencies over the last couple of months, in fact, but I don't regard clemency as one of my plans to depopulate prisons because of this pandemic. And either people are going to get approved or not approved, but not really so much because of the pandemic. That's just not part of the pandemic response as far as I'm concerned. So that is going to conclude the press conference. Again, thank you all for being here today and for tuning in. And again, I want to thank the people of Louisiana, because while we're not able to transition to phase 1 today, we're in a much better place than we would have been had the people of Louisiana not taken seriously the stay-at-home order, social distancing, and hygiene. I'm going to ask that they continue to do that as we prepare to transition to phase 1 on May 15th. And of course, that assumes that we continue to move forward and that we do meet the threshold criteria that have been set forth by the White House. In the meantime, we're going to continue to work this extremely hard. We're going to continue to work to increase our testing capacity and our contact tracing capacity so that all elements of the White House plan will be in place and we'll be able to move forward. So thank you all very much. We'll see you tomorrow at 2:30. We're back at 2:30 tomorrow. Thank you.
All right, you've been listening to Governor John Bel Edwards beginning that press conference by saying he had news he did not want to deliver, and that was an extension of the stay-at-home order. Let's take a look at the latest numbers. You have 295 new cases, bringing the total to over 27,000. 27 more deaths, bringing that number to just under 1,700, but more than 17,000 people have recovered.